We now have 151 assessment centers providing tens of thousands of tests each and every day across our province. And up to 60 pharmacies will be joining that group this Friday. But my friends, we see the numbers spiking up. It's extremely concerning, and we have to act. We always knew that a second wave was coming, and we've been preparing for months. Thanks to that work that we've been doing over the last couple months, and the minister gets all the credit, we're working around the clock. Today, I can announce that we're investing over $1 billion in expanded testing and contact tracing. That's $1 billion to support testing, and this investment will make a huge difference. But until we get Health Canada's approval for new rapid tests, rapid testing that other jurisdictions are currently using, until we get those rapid tests, the health experts are telling us that we need to be more strategic with testing. Earlier today, our top health experts told us we need to prioritize those who are at greatest risk. Starting today, they are asking people to only get a test if you have COVID-19 symptoms, have been exposed to a confirmed case, are a resident or work in a setting that has COVID outbreak, or a resident or work in an at-risk setting such as long-term care homes, shelter, health care. Folks, I want to reassure you, no one who needs a test will be turned away. Because it's all hands on deck right now, we need to be nimble. We need to listen to our health experts. This month, we've added 500 more staff for contact tracing and case management, and we'll be hiring another 500 staff on top of the 500. We're investing $30 million to enhance our outbreak management response. We have a robust surveillance and testing strategy for our schools and long-term care homes. My friends, we have the best minds anywhere in Canada working on this. We're sparing absolutely no expense. There's $1 billion on the table for testing. That's 1,000 more staff supporting contact tracing, $30 million to fight outbreaks, and $70 million for the largest flu vaccine campaign in Canadian history. And I'll have more to say next week about our plan to tackle the backlog of surgeries, protect long-term care homes, and fight surges of COVID-19. My friends, we're all in this together. We will spare absolutely no expense. We'll do whatever it takes, and together we will get through this. Well, I think, we speak from one voice, all the premiers. We don't believe the federal government should be in that provincial jurisdiction. We need their support, but no one understands healthcare better than each province. We all have different needs, and we were disappointed not to see any increase with the Canadian health transfers that were in desperate need. There was some other items we have to get more details on infrastructure and other areas when we ran through the throne speech, but nothing's more important to this country or every resident in this country than healthcare, and we need their support. And we don't need their support with conditions, and they're going to be taking over healthcare. If the federal government takes over healthcare, I think it'd be an absolute disaster. And every premier feels the same way, that they should not be stepping into the jurisdiction of the provinces.